Welcome to Global Health Science Study Series with your Global Health partner Andrew. Once more again today, we are talking about a diagnosis protocol. Diagnosis protocol, this is a systematic step-by-step process that medical workers or healthcare providers use in order to identify underlying conditions that our patients are going through or they are suffering. So what is the purpose of this diagnostic protocol? This diagnostic protocol is set in a way that it is able to provide an advantage to the patient. It is more of patient beneficent-centered approach, which has been set in order to minimize errors and the provision of good health to the patients. That is one. Then on the other side, its other purpose is majorly to save lives and to avoid complication development in patients. So the first thing that you're going to handle in this patient is information collection. So information collection involves two processes. One, there is collection of information related to the patient's biography. That one is called biodata or biographic data. That data is majorly collected in order to help allocate what this patient might be suffering from. For example, there are certain conditions that are related to people within the reproductive age. Then there are those that are related with people who are maybe very young. Then there are conditions related to people who are elderly. So that is why we have to get this biodata. Then also on the other hand, there are certain machines that are used in the laboratory that are majorly dependent on sex and dependent on age in order to bring out results, because we have what they call this results interpretation. And results interpretation, some of the results require the age limit in order to gradually come up with the rightful interpretation of results. That is very clear. For example, PSA, when you're dealing with the prostate-specific antigen, there are age brackets, how this PSA is expected to appear in men. Then also looking at CBC, also CBC depends. There are those that indicate for children, elderly, and all that. So all those protocols have to be followed. So biodata is the first step in data collection in a patient that has just reached your facility. So biodata is very necessary. So as a patient or as a medical personnel, make sure that correct biodata is collected, because on the other hand also it helps in follow-up of this patient in one way or the other. And those ones in private settings, it helps in follow-up of payments and other bills, because you'll have to get the next of kin incorporated in this biodata collection system. So that is then the next one in this data collection is what they call medical data collection. Now, medical data collection now is where someone is going to dig down to ask the patient what brought you to the facility. In other words, understanding the patient's current complaint. This is now basically part of the clinicians. They will ask the patient's current complaint. How is he complaining? How is the condition progressing? All that data with history will be gathered from the patient. So as a patient or as a clinician or as a doctor, make sure you get correct data. When did the patient start getting the symptoms? How are they progressing? How severe are they? Are there other complications related to it? And which state and which level is it now? Such data is collected from the patient, and it helps in management and the provision of basic care for patients. That is in form of medical data. So as a patient, make sure you provide, majorly when it comes to data collection. Sometimes some patients keep to hide this information, but make sure you tell the doctor, because they are not gods to understand what you're suffering from. But your data is what helps them to come up with a basic for your management as a patient. That is for the case of data. Then the other part we are talking about is physical examination. This is when now the doctor puts in his efforts to analyze physically, to localize the condition based on what you have told him. If you have told him, maybe I have a headache, I have what? So the doctor will now go into what they call physical examination. Now, under physical examination, the doctor will prioritize, of course, vital signs. The doctor will go through, gather that information from the patient. After gathering that one, then he goes to the chief complaint. What were you suffering from? You told me there is a swelling here, there is a swelling here. So the doctor will go into palpation and thorough examination in order to come up with a basic and rightful probable diagnosis for these patients. Then the doctor will also go ahead and do what they call alignment of differential diagnosis. So there are so many conditions that might present with that similar complaint. So the doctor will say, okay, if that is the case, now this could be the differential diagnosis. The patient has said maybe they have a headache. So headache can be caused by malaria, headache can be caused by stress, headache can be caused by typhoid, headache can be caused by meningitis. So a doctor will have a variety but based on the detailed data collection that the patient has provided to the doctor, based on the onset and how long it has taken. So the doctor will be able to prioritize certain laboratory tests that he may request for. So the next step after he has come up with a differential diagnosis is now the laboratory investigation. So the laboratory investigation might incorporate, of course, radiology on the other side, then medical laboratory tests that the doctor or the clinician will request based on the data that he has collected from the patient. So as a patient, make sure your data is key and make sure you provide the rightful data. So when it comes to the lab, now, this is where issues are. Now, when it comes to the lab, sometimes maybe the doctor has requested for a particular test, but as a laboratory personnel, you should be well acquainted with all your laboratory procedure protocols. That means there are certain test procedures that might require pre-analytical preparation, analytical organization, and post-analytical procedures to be done. So in this doing, now for the case of pre-analytical preparation, that means you should be well aware. For example, maybe when a patient is going to do what they call sperm analysis, so the patient might be advised to abstain for like 2 to 3 or 5 days. So in so doing, that's why laboratories are also incorporated in this case. So as a laboratory personnel, be acquainted and always be aware of every procedure protocol that you're doing. In one way or the other, these are diagnostic protocol is a combined effort that brings all medical personnel into one. The clinician has to relate with the nurse, has to relate with the lab person in order to come up with the rightful management of this patient. Because if we don't coordinate together as medical personnel, these patients will get what they call misdiagnosis. And misdiagnosis can result into loss of life. Remember, the goal for a nurse leaving her home, going to facility is to save life. The goal for the laboratory technician or a lab personnel leaving his home to go to the facility is to save life. The goal for the doctors leaving their homes to go to medical facilities is to save lives. So if all our common target is to save life, that means we are all required to come into together in this diagnostic protocol to understand. Now, let me break down. When it comes to the laboratory, I told you this is what they call pre-analytical steps. So these pre-analytical steps are always done in conjunction with the clinical department, whereby when a doctor maybe has requested for fasting blood sugar. Fasting blood sugar, now this requires the patient who have fasted. Maybe they have just said, it's okay, go and do fasting blood sugar. Patient comes to the facility. It's not about picking the sample and performing the procedure. It's about understanding as the patient fasted. So this requires a conjunctive understanding where the laboratory personnel come and the clinicians come and they all come and merge together to bring out the best into our patients. So looking at that, those are the protocol that we are looking at. After you have done this, so still the laboratory people have got a bigger right to play where you have to go and participate in the result interpretation. Certain people might not be able to understand results interpretation because localized facilities have different ways that they interpret results. For example, in malaria testing, some people prefer plus notation. Some people may prefer interpretation based on relation to white blood cell count. So all these things need a conjunctive understanding where the laboratory people, the clinicians, come on board in order to come up with rightful diagnosis of our patients. So after everything, after the diagnosis has come, so these results will be brought to the clinical department. When you're in the clinical department, results have reached to you. Don't sit back, don't struggle alone. If you don't understand results, please reach out to the laboratory and inquire and say, I don't understand these results. It is not a crime to inquire because inquiry is part of understanding. Every day in our medical field, we learn. Science keeps upgrading and more science keeps evolving. So in so doing, we need to have a synergy. That means a combined energy in order to abscond or remove these factors that might lead into misdiagnosis. So in so doing, realize that when these results are brought back to the clinical department, as a clinical department, results interpretation is key for the rightful management of our patients. So after you've interpreted these results, well, of course, treatment will be prescribed. After treatment has been prescribed, this means the ball has now rolled out of the clinical department back to the nursing department. Now, in the nursing department, that means you've got to cross-check treatment. Sometimes maybe you realize a child, a very young child, has been given a higher dose that maybe this is not actually appropriate. It is not wrong to go and ask that doctor, I think there is an elevated dosage. Is it appropriate? Sometimes doctors recommend certain medications based on conditions. But sometimes there is what they call exhaustion, where a doctor has worked for more than unexpected number of patients. So errors can surface. So in so doing, before treatment is administered, make sure if dosages are not appropriated like how you think they should be, please go out and reach out to the doctor, reach out to the clinician, reach out to the person who made the prescription, and make sure that the prescription is aligned to that very patient. We are not robots in the medical field. We are supposed to coordinate, understand, and relate to one another to come up with a rightful diagnosis to our patients. So after this has been done, now the medication has come to the nursing department. Make sure you cross-check with the treatment so well. Check with the treatment plans. After you've checked with the treatment plan, administer the treatment and make sure that the treatment is documented. So this is all part of the diagnostic protocol. After you've written, but before you administer, of course, you must cross-check your medicine from the shelf. As you pick the medicine from the shelf, before you aspirate the medicine from the ampule, during the mixing process, and when you're going to administer, make sure you cross-check more than 3 times so that you are able to liberate yourself from errors of drug administration. Because at the end of the day, our target is to save lives. So after all these things have been done, so monitoring and review majorly involves a combined effort whereby the patient has been prescribed treatment and the patient is now in the ward. For those that have been admitted in the ward, and the doctors need to keep on going to perform ward round, but of course it's not only doctors' responsibility. Nurses are supposed to be in the ward round. The lab people are supposed to be in the ward round. Why? Because there are certain samples that will require to be collected in certain rightful containers. I remember one time someone bringing for me a CBC sample on a red top, but before even reaching to the laboratory, the sample had already clotted, and there was no way. Now remember, at the end of the day, the center of it all is patient's comfort. But now if you go back and start pricking the patient 2, 3, 4 times, this is not good. You're pricking a patient for BS, you're pricking a patient for RBS, you're pricking a patient for CBC, you're pricking a patient for so many other things. So in other words, this necessitates consultation from the laboratory department, which vacutainer should recollect this and preferably providing any other technical guidance that is required in this case. Then, of course, after all this has been done, the last one is follow-up. There are certain medical conditions that will require follow-up. So follow-up is a step-by-step process where a patient has been given treatment, maybe the patient has improved and the patient has gone home. The patient might be required to come back after some time in order to understand whether the patient has really adhered to the treatment. Sometimes they might not come back, so medical workers might be advised to follow them to their home states. That's why we pick biographic data so that we can locate your location, come check your place, do maybe a post-HIV treatment and all those other things, the TB sample collection, and we continue monitoring to see that the patient's care is provided at the center of it all. So if this video has been so important to you, I would request you to subscribe, like, and share. And if there is any comment you want to put it at the comment section so that it will be able to improve on the provision and the ability to bring out the best always for you. Thank you so much, and I will always be there to bring out to you Global Health Science, your true health partner. Thank you so much.